So far, the panels and the discussions were mostly focused on the problems and the issues with healthcare and how it deals with pandemics and chronic diseases and cancers. I'm going to focus on solutions, and these are specific scientific solutions. I'm a scientist by training, and my passion is to transform the current healthcare from a reactive one that's mostly focused on managing the symptoms to a new healthcare that's focused on preventing any diseases, including cancers and aging. So let's dive right in. So my first slide is a bit of visual, and it's here to make a point in that my son today will learn about the pandemic that occurred here in the 13th century that wiped out a third of the population of Europe, Middle East, and Asia. And he doesn't live in fear of this epidemic at all. He doesn't even have to know about it. This is the bubonic plague that's swept through here. And at that time, literally no one knew what caused it. So if you got it and died of it, it was bad luck, right? And millions of people died. But today, we know exactly what causes it, how to prevent it, how to cure it, and so no one's afraid of it, and we don't have any global system in place to prevent such a pandemic. And so, but for chronic diseases, and no one mentioned this number, 41 million people in the world die every year from chronic diseases, and that's just really the tip of the iceberg, because what happens prior to the death is years and sometimes decades of suffering, not only for that person, but for their cloud around them, right? It's continuous suffering. And so we have a massive epidemic occurring every day, and there is no system in place, to my knowledge, that's actually proactively working on finding preventative solutions. It's always about what drug can we give you for the disease you already have, instead of can we look back 10 years and prevent that disease. That's what I focus my life on. So let's basically put chronic diseases into history books so that future generations can read about multiple sclerosis as a disease that used to be around. We now know exactly what causes it. We know how to prevent it. No one has it. Great. Instead of my neighbor dying of it, and there's absolutely nothing that modern medicine can do for her, and her family is watching her die every day. That's today's norm. Very unfortunate. So let's dive right in. So one of the big takeaways from my talk is that today we possess all the technologies to prevent all pandemics, to prevent and cure most chronic diseases, to prevent and cure most cancers, and to slow down aging or increase health span, however you want to look at it. Today we have it all, and it's available to everyone. So if you come from a small country or you think you're a poor country, you can actually implement this technology in your country. This is not some moonshot that you want to go to Mars. These are laboratory and computational technologies that are very available and democratized. So anyone can actually use these to develop what I'm going to talk about. And so we possess all those technologies today, and this lady is 103 years old, and she hasn't taken any drugs. There's no miracle about her. She just has a physiology that's fine-tuned. And how do we achieve that? We just need to understand the chemistry that has led that kind of a healthy life. And so let's do that for a larger population. So one of the most important concepts that we've been missing from the entire approach to how to solve the human chronic diseases and cancers problem is that we've ignored the vast majority of our human body. We have basically lived a fallacy over the last 20 years that it's the human genome that determines chronic diseases and cancers. And now we know that that's not the case, that there's this microbial component where in us and on us, we have just as many microbial cells as we have human cells, and that we depend on these microbes to live a healthy life. Without these microbes, we cannot live a healthy life. And if these microbes change their behavior, it's going to affect our behavior. And so I encourage everyone after this talk to go and Google things like microbiome and mental health, microbiome and any disease you want, gut-brain axis, and so on. And you will see that these microbes are now likely the most important determinants of chronic health and chronic diseases in humans. So we have to include them in all of our studies. And then I have 2 slides on the power of microbiome, which I think are very interesting stories. And we learned earlier this morning that stories are important. This is not hardcore science. So if you have not heard of a medical procedure called FMT, it stands for fecal microbiota transplant. And it's a very nice way of saying you take feces from one person and put them inside the intestines of another person. That's what it is, but it's called FMT. It sounds much nicer, right? And so most physicians would think that bipolar disorder is the disorder of the brain. It's a disorder of the brain, and that you have to treat the brain chemistry. But in fact, this one person was documented to completely cure bipolar disorder simply by transferring feces from her husband to herself. Completely cured. And you can read, this is a freely available peer-reviewed publication that I outlined here, which is miraculous basically, but it works. The next example I want to give you is a immunotherapy for cancer. So in this particular case, two institutes in the United States, the NIH and the MD Anderson Cancer Center in Houston, performed these studies where they administered an immunotherapy drug against melanoma in melanoma patients. And what they observed is a very typical outcome of any immunotherapy, which is that some people responded and the cancer went away, other people did not respond and the cancer continued to grow. So what they did is they did an experiment where they performed an FMT. Remember, that's a nice way of saying they just took feces from this person and put them inside the intestines of this person. They administered the same drug again, in the same genetic background, in the same person, with the same environment. Everything else is the same. And boom, all of a sudden, that non-responder turned into a responder and the cancer retreated. So these are two very powerful examples. I could speak for days about the power of microbiome, but hopefully these will just inspire you to go home and read about the power of microbiome and how we have to include it in all studies of the human body, because it is a part of our body. We cannot ignore it. We've been ignoring it for too long, and that's why we're here. So how do we then solve the problem of chronic disease and cancers? We have to create a very, very deep digital twin of the human body at the molecular level. We have to understand what is it about that 103-year-old woman who can do gymnastics and most people are dying in their 70s, right? What is it? It's just chemistry that we can now measure. We didn't understand it before and we still don't understand it, but we can now measure it for the first time. And so we have these so-called omics technologies. You guys have heard about DNA. Most people have not heard about RNA, but that's a very important part. And so we can actually now, instead of going to a doctor and getting your blood drawn and getting 4 data points, your cholesterol, LDL, HDL, and triglycerides, you can actually get 100,000 data points from these kinds of technologies. And they're becoming available to the masses. And so why are we limiting ourselves to very few data points? So we want to digitize the human body in a very profound way, and then, as discussed earlier, profile the human body over time and add labels to each person, whether they're healthy or getting sick or sick already, and then we can go from there. I also want to address this point here, which is don't focus on AI. AI is simply a tool that allows you to interpret vast amounts of very accurate data. That is what it is. If you don't have accurate data and you force AI to find you something, it will find something without ever knowing that what it found has no relevance to what you're trying to do. And so every time that you set up or fund or support any project, ask the hard question, which is a very hard question that people do not want to answer, which is, what data is AI actually going to explore? How were they generated? Were they generated using a very trustworthy method that provides accurate data across the entire population? Or was this just some public data that someone mined quickly and they're going to promote their AI platform that it's going to find something important? That is not going to happen. You're wasting your time and money, and life is too short to waste. So if you're going to focus on AI, ensure that the data quality that goes into AI is high. And it also needs a lot of data. It can't use data from a few people. Okay, so now that we can profile the human body in a way that it's never been done before, including the entire microbiome. And SARS-CoV-2 is also a microbiome. It's a virus. And when it affects us, it becomes a part of us. So if we're doing this global routine biosurveillance of the entire world population using this method called RNA sequencing, if we had done that at the onset of the pandemic, and if we do that at the onset of the next pandemic, we would have actually immediately, when very few people are infected with this virus, we would have obtained the full sequence of the virus, given it to a company like Moderna, and they would have had a vaccine within 2 weeks. And so not only that, but that full genome sequence can then guide the development of rapid tests and contact tracing. So I want the future pandemic to be contained to the outbreak local area when very few people are infected and not spread globally. We discussed earlier that the amount of effort to manage a global pandemic is absolutely crazy, right? And still, even if you do that, you're going to suffer a lot of deaths. So why not focus our efforts on identifying the epidemic when only a few people are infected, kill it there, and then you don't have to have this massive effort and massive preparation. That's much, much simpler problem to solve. So the technology, all of this technology is here today. There's nothing new to invent. We just need to do it, and that's it. So I wanted to, this is one visual takeaway for you as well, that I like to say that healthy people have many wishes. They want to do many things. They're excited about life. They want to do, they're productive members of the society. Sick people only have one wish, and that is to get rid of that disease, right? So when someone is sick, that's all they think about. That's all they're focused on. And when someone is depressed, which we now have an epidemic of depression and anxiety, when someone is depressed, they don't really want to be a productive member of the society. They just want to be on their own and be left alone. And so these are some visuals that these people are not really enjoying life, and they're not productive members of the society. And we now have all the tools and technologies to prevent that from happening. So let's do it. So a little bit of a personal story. I'm very passionate about this because I was diagnosed with a chronic disease in my 20s. So I had autoimmune disease, which means that the doctors have no idea what causes it, but they have drugs to treat it. And when you read the list of side effects, you just say, well, I don't really, I'm in my mid-20s. I don't want to have failed kidneys, and I don't want to monitor my liver every month for the rest of my life, and I don't want to, wear diapers for the rest of my life. Those are the drugs that are being used today. They have massive side effects. And so I spent 10 years, unfortunately, degrading during that time and heading for a wheelchair. I spent 10 years researching what I could because I knew that there was nothing genetic about this. And I found a diet that when I switched to that diet, I completely cured myself. I have been completely symptom-free for many years. It took about a year to heal because I was in a pretty bad shape. But I completely healed, and I've never had symptoms since then. And so why don't we just prevent disease instead of treat it for the rest of our lives? So this was a huge aha moment for me. And if you look at this, these are now just numbers. When people say that we're going to be spending $185 billion just on autoimmune diseases, that's just a number. But it's a number that governments can no longer afford. The population cannot work hard enough in order to produce that kind of money to pay for the drugs. So we're just entering this vicious cycle where we have to get ahead of the disease. We cannot wait for the disease to develop. And for the population to have such a large number of autoimmune diseases that no one knows what it is, that's just unacceptable today. We have all the technology to understand it, so let's do it. And so this slide simply highlights that chronic diseases are actually on an increase. So they're increasing in prevalence, and this is not due solely to the aging population. If you look at type 2 diabetes, which is one of the most prevalent diseases, you can see here in blue is the people who currently have diabetes and their ages are here. But you can see in orange here that it's the new cases, the incidence of type 2 diabetes. You can see that it's shifting to younger populations. And this is just an example. The same thing is happening with IBD and multiple sclerosis, colorectal cancer, and so on. And so we have a phenomenon where younger and younger people are suffering from chronic diseases that were simply not known to exist in such young populations. One of the biggest fallacies, like I said, of the last 20 years is that genetics is the root cause of chronic diseases and cancers. And so it's basically bad luck. But that's not true at all. And now that's been scientifically established. And you can just go back 1 or 2 generations and ask yourself, how many people were sick? How many at that time? Chronic illness was very rare just 1 or 2 generations ago, and now it's very common. And now we have good evidence that most of these diseases, chronic diseases and cancers, are actually not genetic. Diet and lifestyle and microbiome play a major role. So what I've worked very hard on for the last 13 years is to develop a preventative strategy that's solely based on nutrition. So this Nutrition 2.0 is what I call it. Everything that you need, you can buy in the grocery store, 100%. There's no need to order any special item. There's no pharmaceuticals. You don't need any approvals from anyone. It's just nutrition. And so Nutrition 2.0 is very different from the current nutrition in that it is 100% data-driven. What data-driven means is that you have to sample the human body, saliva, stool, blood, and so on, and you have to measure what is going on in that body before you can then use mathematics to compute that diet. And currently at my company, we have about 300,000 customers, and the computers have recommended 300,000 diets. Our computers don't know anything about the Mediterranean diet or ketogenic diet or anything like that. They simply compute a diet for every single person because every single person is different. And then the goal of this Nutrition 2.0 is to prevent chronic diseases, cancers, and aging. So let me quickly walk you through some examples here. This is all published work, so you can go read about it if you'd like. But basically, the blood sugar spike after a meal is very personal. Every person responds differently to different foods. We're not all the same. The table you can find on the internet is for the average human. And there isn't an average human in this room. None of us are the average. Each one of us are individual. So if you observe that, you can actually now measure the glucose response. And this is where machine learning is very important. For example, we did this large research study in the USA and Japan, and we actually measured the glucose response to 60,000 meals in 1,100 people, and we developed this model. So we measured the stool RNA, we did a stool RNA test, which is what I call chemistry, and then we fed all that information to AI, and AI computed the machine learned algorithm or the math. And so now we can measure the chemistry of a person, overlay the mathematical algorithm, and compute exactly what a person should eat and what a person should not eat. And it's different for every person. And so let's apply this principle to many other things. So at my company, we can only do so much. We've done it for type 2 diabetes and have gotten very good results. This is all available as a preprint and currently under a peer review. We've done it for depression, which is one of the largest problems. You can see here on this graph that depression increases along the scale, and we took people that have this level of depression in blue at the beginning of the nutritional intervention, and this is the control population. And you can see how we were able to shift to orange people with the personalized nutrition. They dropped their symptoms of depression by 47%, 100% nutrition. There are no drugs involved here. There's nothing weird. Just go to the grocery store, eat foods that are good for you, and don't eat foods that are bad for you, and take some supplements, and this is what we observe. And we're also submitting this for a publication. And just a reminder that cancer is not a genetic disease. Please read about that if you're interested, but I've highlighted here one paper, and then every solid tumor in the human body has a microbiome inside of the tumor, and that microbiome is helping the tumor avoid the immune system. So it's a part of the tumor, and we have to understand what the microbiome is doing and how it's preventing the immune system from fighting cancer. We're applying similar strategies of Nutrition 2.0 to cancer and aging, but this is something that we cannot handle as a small company. This is something that really requires a global participation. You know, take this principle of Nutrition 2.0 and take it to cancers and take it to aging. It's all out there. And this is the last technical slide, something that I'm really, really excited about. So you've heard of anti-cancer immunotherapy. Now we're getting into anti-cancer vaccines, and those are showing very good promise. What I would like to develop is an anti-aging vaccine, so that once a year, you can just simply inject a vaccine into a person. Remember, it's always chemistry and math. It's not just AI, but you have to measure what is causing aging in that person, and you can provide them with a vaccine, train their immune system to clean all the cells that are not performing their function, and then basically improve their age. And happy to discuss that more. It's sort of a novel concept. So what can you all do as governments? I've listed some things here that are very, very important, which is we need to train more people who are doing clinical research on humans, not mouse studies, not worm studies, not cell studies, but humans. We need to do more research on humans, and we need more data scientists who can do AI machine learning. We need to fund large clinical studies. You cannot learn about a complex human disease on 3 people or 20 people. You have to do thousands of people and analyze tens of thousands of samples. We have to integrate preventative approaches into the healthcare system. So we have to teach doctors how to make food recommendations, not just prescribe pills, how to encourage people to exercise and live a healthier life, make good nutritional choices. We need to teach diet and lifestyle in schools. I'm not aware of any country that has implemented this as a strategic move to teach children about the importance of diet and lifestyle from grade 1. And I think it should be. This is not now sort of pseudoscience. Nutritional science is science now, and that should be taught. And then finally, when it comes to implementation of all these technologies, find a way to reward businesses whose business model is to keep people healthy. Today's businesses that are involved in healthcare, their business model is to keep people sick. That is the business model. So why not find creative businesses whose business model is to keep people healthy? And then we'll be able to do greater things as nations. The takeaway is that everything that I just talked about, we can do today. So don't go back home and talk about it and say how cool it is and say we don't have money, we don't have the resources, we're a poor country, we're a small country. Don't wait for big countries to solve this problem. Actually, small and medium-sized countries have an advantage. You guys don't necessarily have as much bureaucracy. You can make things probably work faster and cheaper and can get more efficient solutions to the market instead of waiting for big countries to take care of this. So do it. Just go home and do it, and let me know if I can help in any way.